were some big challenges. I think big ones were confronted head on. I think we had a rule in Southeast Queensland where we said when the doors closed, we speak honestly and we address issues of trust and control directly. And so we kind of learnt that it wasn't until we had some fairly rigorous debate that we got people on the same page. It was a whole heap of nodding and kind of shaking hands and signing agreements, but it wasn't until we actually had quite a couple in the early days, dust-ups, if you like, about exactly what the agenda was about. Because in order to achieve common goals, we had to individually surrender individual control and share that with each other. And developing trust was really important across those four organisations. I think all those four organisations were born from a single Aboriginal organisation in AICS Brisbane. So back in 1973, AICS was established as the first Aboriginal medical service in Queensland. Obviously in Brisbane, over time it supported the other three Aboriginal medical services to develop their community control health services and enjoy their own autonomy. Then I think there was a bit of a threat that it was perceived by the other three organisations as a bit of a kind of reverse takeover. So we had to address that up front. And I remember the discussions like they were yesterday because they were really powerful, and there's a couple of slides that we continue to remind ourselves about, the point at which we came together, which was where we tabled these are the challenges and the opportunities. Do we all agree this is what we need to be focused on? Well, then let's push politic and individual issues of control and CEO, interests aside, and let's focus on how do we collectively address these challenges, because it was pretty obvious that not one of us individually could without coming together. So having data collectively compiled, so data that sat across four organisations and overlaid with census data, we were able to paint some fairly bleak pictures which kind of straightened everyone's backs. When we started talking about politics, we talked about the cost of politics and it's not being able to deliver on your objects, and that is responding to the health needs of our communities. This huge growth that's occurred over the last 5 years has meant that we were irrelevant to the conversation, to be honest, about addressing health needs in urban southeast Queensland. And so whilst we might have started the movement, we've got a really rich history that we share across those four organisations. The burden was a pretty heavy one when we realised that if we didn't make some fairly fundamental shifts, if we didn't challenge ourselves, then we could be the ones that could have been on our watch that we didn't continue the mission. And I think that was really good pressure that was put on the network. But again, using information to be able to keep everyone accountable. We talk about in Southeast Queensland there's a bit of friendly competition about how organisations perform and how clinics are functioning and how boards also conduct their business too. And to be able to create this kind of peer pressure, which isn't an external accountability to funding bodies, it's created an internal accountability to ourselves, but particularly also to our communities, because we report everything we do to community now. We make sure that the report card that we produce is delivered to every single member of our AMSs across the region in the lead up to AGMs. We get on the radio and talk constantly on Aboriginal media. Our community days are huge opportunities to engage community. So the ability to report back on what's happening, to be able to present data to ourselves and also to community, creates an accountability, which is what we say is the building block of community governance. And that would be a tip, the power of data. And no one can argue, and I dare any government to argue, because a lot of the data we collect, they don't. And the quality of their data is nowhere near as clean as ours. So we present data which demonstrates a return on the investment, creates an accountability, which means that we must continuously improve. And that then creates the true sense of community control, that it's our communities that control our agenda, that we're accountable to them. Our government's a funder, but they don't own these organisations.